afternoon. Today we will present to you the selection. My name is Dylan Wachtel.
Mikhail Rasul.
Sophia Gaitan. And Brianna Terry.
Firstly, what is this about? We have been tasked with the decision of selecting a heart transplant recipient from the given list of 5 possible candidates.
And this is our research question. What are the key factors for when deciding for heart transplant patients?
Some of our criteria to narrow down our decision was to narrow down to 3 factors. First, the financial situation of the recipient, which includes the socioeconomic status and the insurance situations of each candidate, because that becomes a major factor when deciding who receives the heart. Next is our family ties and needs, because some of these candidates have families that depend on them more than others, and that can play into who we decide. And which can be considered the most important is the health and the well-being of these candidates, because how they are pre-transplant needs to be closely monitored and checked to ensure they are the right choice.
So first, we start off with candidate A. She's a 41-year-old woman. She's been sober for 14 months now, which shows her determination to keep going towards recovery. And she also has a 6-year-old daughter, which shows that she has some sort of motivation to keep going with the recovery. And she also has a job after the surgery, which shows stability. But one of her 2 main concerns are that she has a history of alcoholism, which rises health concerns, and also that she has to take care of her daughter without a father figure.
Next we have candidate B, which is a 59-year-old man. Some of his pros are he's hardworking, so that will assure that he has a steady income, and he has a bigger family, so he would need to be there for them, to support them, and he also has grandkids he wants to be there for. And he previously used to smoke, but he has recently quit, so that's also a pro. And then a couple of his cons are he is in some financial debt, which doesn't help. And then he does have high blood pressure, which is gonna make some complications for surgery. And he was also previously an addict, like I said. Next we have a 30-year-old woman. Some of her pros are she's young, which means she has good potential with recovery. She has been taking steps to take care of her health, and she's willing to adjust her work schedule around the surgery and recovery. Some of her cons are she likes to smoke and drink a lot, which is not going to help with the surgery, and she also has an irregular heartbeat. Next we have a 45-year-old father. Some of his pros are he has good health and no history of health conditions or problems. And he's also financially stable and has steady insurance, and he has a bigger family, and he wants to make sure he's there for them and is healthy to take care of them. The only con is he is middle-aged. So lastly we have a 35-year-old woman. Some of her pros are she is young and has a very long life ahead of her if she gets this surgery, and she is ready and taking the steps to prepare for this surgery if she gets it. And her cons are she has severe heart issues and pains in her heart, no family, and no health insurance or money.
So, who did we pick? We chose candidate D, who was the obvious choice, but he's obvious for a reason. Firstly is the financial criteria. According to Resolve Medical Bills, it is the most expensive medical procedure in 2024, which can come up to $1.6 million when you add up all the fees and charges. This shows a prevalent barrier for lower economic individuals to have access to heart transplants, which is why we must face the harsh truth that those of lower socioeconomic status have very low chances of being chosen for a heart transplant. According to the National Library of Medicine, studies primarily conducted in the United States have also reported that depression before or early after transplantation is associated with higher post-transplant mortality. So you can actually connect depression to socioeconomic status because those of lower socioeconomic status tend to have lower levels of depression, higher levels of depression. As you can see in this graph here, there's a direct correlation between your socioeconomic status and levels of depression. This obviously does not apply to everybody, but this trend causes hospitals to choose those of higher economic status more often. Additionally is the need for private health insurance, because without it, there's really no way you can pay for this without going into debt for the rest of your life. Studies in heart transplantation have demonstrated higher levels of mortality, graft survival, and higher rates of rejection for recipients receiving heart transplants with Medicaid health insurance coverage compared to those with private health insurance. You can actually survive, you have higher chances of survival when you have private health insurance because you can pay for all the little fees and checkups that public health insurance does not cover.
Family. Who depends on this person and what would happen if they were gone? So he has 3 daughters that depend on him. He's the bread maker of the family. He also has a wife that stays at home and doesn't really work. Without a strong male influence, a daughter may struggle to establish healthy boundaries, and they may be susceptible to negative influences. Without male influence, a daughter may be susceptible to negative influences. Without a strong male influences, a daughter may struggle to make sound decisions, and they also may struggle to build and maintain relationships. This graph shows how fathers contributes to children's well-beings, and those who don't have a father, they tend to be homeless, high school dropouts, and are higher rates of suicides.
Alright, next we have health. And for physical health, we have the age factor and the health issues. And for the candidate's age, he's 45 years old, which lies right behind the average age for a heart transplant recipient, which is 46 to 63. And that shows that he's not too old to get a transplant, so his recovery afterwards won't be as rough. And he has no major health issues. He's not overweight or underweight, and he falls in the average BMI of a heart transplant recipient. And this is a graph that shows the age of donors and recipients.
Managing heart rate is important. Okay,
Thank
thank you.
you.
Thank you.